Allison Upshaw, and this is my wound care video. So before I enter the patient's room, I'm going to do hand hygiene. And when I enter the patient's room, I'm going to introduce myself, do patient identity, and explain the procedure. I'm going to raise the patient bed. I'm going to obtain consent. I'm also going to draw the privacy curtain. I'm going to raise the table as well. And I'm going to make sure they have their prescribed analgesics and ask if they're in any pain. And I'm also checking the documentation for irrigation solution and signs and symptoms. Now I'm doing hand hygiene again. And I'm going to don my clean gloves to take off the wound dressing. So now I'm taking off the wound dressing. I'm inspecting the pad for drainage, so the amount, the color, the type, the consistency, the odor, and then I'm throwing this in the garbage. And now I'm inspecting the wound for redness, ecchymosis, edema, drainage, and approximation. I'm palpating for edema, and I'm feeling for warmth. And now I'm going to doff my clean gloves. Throw it into the garbage, perform hand hygiene again. Now I'm going to position the patient to make sure that their irrigation goes into the kidney basin. I'm going to put on my blue pad. I'm also going to put on my kidney basin. And now I'm going to set up my dressing tray. So I'm going to put this as the garbage. And now I'm going to put this aside. I'm going to open my dressing tray. Throw this in the garbage. Now when I open my dressing tray, I'm going to make sure I open it away from me and only touching the 1-inch borders. And I'm going to get the tweezers. And now I'm going to square this out on the table and place this on the side on the 1-inch border that's unsterile. And now I'm going to put my supplies in. I'm going to use the banana peel method. And every time I'm placing this back on the border. Throwing everything into the garbage.
Oh yeah. I'm not like after I put my clean gloves on order. It's okay, I'll just do it before. Okay. Just put clean gloves on and we'll take pictures of them. No. Okay, after you do the glove inspection.
It's on the side.
And then you can do the
I'm putting my abdominal pad onto the sterile field. The garbage. And now I'm going to get my packing strip. I'm going to put it upside down on the sterile field. Over the sterile field, take some out using the tweezers. Put the tweezers back down. Now I'm going to use the scissors to cut some so that it drops onto my dressing tray. Okay. I'm going to place this back down. Close my packing strip. Now I'm going to get some irrigation and I'm going to make sure I don't splash any. And the last thing I'm going to do before, one of the last things I'm going to do before I put my sterile gloves on is take out the packing strip using my tweezers. I'm going to throw both of these into the garbage. And now I'm going to use my cotton tipped applicator. Again, using the banana peel method. This part is unsterile. Throw this into the garbage and I'm going to measure the length, the width, the depth, and then I can throw this into the garbage. And now I'm going to put on my sterile exam. So I'm going to throw this out. I'm going to put on my sterile gloves, sorry. So I'm going to open it. And in reality, we would have more room, so this wouldn't be touching. I'm going to open this. And I'm going to start with my dominant hand. using proper sterile technique. And now I'm going to put my left hand
I did. No. The video, in the video, the only thing you need to see going on.
I'm making sure not to touch the inside. Adjusting only on the outside. And now I'm going to put this onto the side. And now I have my sterile gloves on so I can get my irrigation solution with the syringe. I'm going to get my blunt needle. I'm going to put it on. And I'm going to safely take off the cap. And I'm going to irrigate the wound until the drainage is clear or until I've administered the ordered amount, going into a zigzag motion, going from top to bottom.
I guess I'll do it. Wow.
Okay, now I'm going to put the cap back on using the one-hand method. Place this on the side. And now it's wet, so I'm going to dry it using some 2x2 gauze and tweezers. So I'm going to just dab the inside first, so inside to outside. Just dab gently. And now I'm going to throw this into the garbage. And I'm going to get another one. And I'm gonna gently dry the outside now. Just drying on this side. Just going top, down, throw that out. One more on this side, top, down, throw that out. And then one on the other side, top, down, throw that out. I can throw the tweezers out as well. Now I'm going to put on my packing strip, so I'm going to soak this in the solution. I'm going to wring out excess. I'm going to place this in my hand, and I'm going to use the tweezers to pack, and I'm going to make sure I don't touch the wound with my forceps or my glove. Okay, now it's packed and I can throw this out. Now I'm going to add my 2 4x4s. Now I'm going to place my abdominal pad. I'm still maintaining sterile technique. And now I'm going to take some of the tape I prepared and tape it to the patient. And now my wound dressing is done, so I'm going to take off my sterile gloves. I'm going to throw it into the garbage. I'm going to perform hand hygiene. I'm going to clean up the area. I'm going to lower my table and lower my patient bed. And I'm going to write down my documentation about the wound condition, any signs and symptoms, redness, edema, ecchymosis, drainage, approximation of the wound. And I'm going to clean everything up. And that's the end of my wound care assessment and video.